Welcome to the heart of PHC. Today we are joined by Sarah Wignall, our HIV and STI Prevention Services Manager here at Primary Healthcare. Sarah's work is all about helping underserved communities get the resources, education, and support that they need. From expanding testing access to fighting stigma, she is passionate about meeting people where they are and making a real difference. We're excited to talk with her today about HIV and STI prevention, the ongoing impact of stigma, and what keeps her inspired in this important work. Welcome, Sarah.
Hi, thanks for having me.
Absolutely. So can you tell us a little bit about your background and what led you to work in HIV and STI prevention?
Yeah, so I graduated from Greenville University with my bachelor's of social work. In mid-semester, I changed my degree from pre-med to social work, and I got a lot of questions of why, and specifically my dad saying, you're not going to make no money there. But because I wanted to work with people and build those relationships on a deeper level, I chose to have the degree in social work.
Yeah. Well, we're glad you make that change.
No, seriously, we are.
I have a background in mental health, substance use, and now HIV and prevention. I had a friend that working at Primary Healthcare in the project, and she was a case manager, and then she left, and then she came back. And she just kept coming back. She kept talking about PHC and the mission, and so I was like, I'm going to give that place a try. So I came in, I was a case manager, and then about a year later, I was like, I really like it here. So I applied and got promoted to the housing case manager. Loved it. I loved the people I served there, just breaking those barriers down that you see when someone has housing instability. So I continued to work and build, and then I was promoted to the prevention service manager, and here I am.
Okay. And you've been in that role for how long now, Sarah?
3 years.
Yeah.
Okay. Well, congrats on 3 years.
Yeah.
That's amazing. I wanted to know, Sarah, what are some of the most common misconceptions or stigma-related beliefs about HIV and STIs today, and how do they impact your work in prevention and education?
Yeah. Honestly, stigma impacts everything we do. We have to be careful with the language we use, how we present ourselves, where we're at in the community. A lot of the stigma we still hear is, well, I'm married, I don't need testing, or I'm not gay, specifically with the MSM population. So if people will say to us, well, I don't have sex with men, I'm not a man, I don't have sex with a man. So it's easy to just right away just say, give people education and the tools that they need. It only takes one time.
Yeah.
And then also I have been with my partner for years. The testing, so the more we get into HIV, the more you learn, and the more we learn that the statistics show low rates of different ways of transmission. So we know that the different types of sex that you have could be an increased chance of contracting HIV. But because those are so low and they look so low on the paper, people think that's not going to happen to me.
Sure.
And again, it only takes that one time. So. And then we also hear things like, I'm going to die now, or I can't be a mom now, or I'm never going to be able to have sex again. And those are all not true. Once someone is detected with HIV, we can get them on medication, and then they can hit that U equals U status, and then they can't pass that virus on to their sexual partners. Mothers can have babies, and they can breastfeed under doctor's supervision. So those are all things that are false.
Yeah. So the education part of what you do is really, really important.
Yes.
Yeah.
Well, Sarah, can you explain the difference between prevention, testing, and treatment, and how they all connect?
Yeah, so prevention, we're using and providing different resources to reduce the reasons someone would be at a higher vulnerability of HIV transmission. This includes testing, so just knowing your status is the key to ending the epidemic. Treatment is how we get to that undetected status, so U equals U, where you can't pass the virus on. And then, and this is also true for the other STIs and HIV. So like hepatitis C, we also test for that, and then we can get treatment for that here at Primary Healthcare. And then we have, if someone is living with HIV, we have a wraparound service. So we have case managers, we have the medical care. So it's kind of that easy handoff, warm, embraced, what we want environment. So
Very nice.
Can you talk, Sarah, about kind of the trust piece and how that impacts your work? So like specifically working with folks who have faced medical discrimination in the past due to any myriad of reasons. Can you talk about what that looks like, building trust with them?
Yeah, that's something I hold very dear. This last year has been really hard, and just the relationships that I've built in the community have really kept me going. So we take that very seriously, and it's all about relationships. When I was first when I was hired for this position, I had someone come up to me and say, you have a lot to prove to this community. What are you going to do, and how are you going to prove it to us? And so this last World AIDS Day event, I had someone that came up to me and said, you did it. You finally made a difference, and you finally showed up for the community, and you're here, and I didn't think we would ever get here again, and you care, and you've proven that to us. And so that means a ton to me, and just the relationships that I'm building and the people I get to meet, and just wearing it proud on my sleeve when I'm out in the community and smiling and just making those connections. So I would say relationship is everything. Also just showing up. Yep. There's a lot of events we get invited to, or that we want to reach out to and say, hey, can we come test? Can we give this opportunity to you and your folks that you serve? A lot of times they'll be like, well, you can, but we probably won't get anybody to test, or, I don't really know, or can you leave those condoms at home? But we just show up, and we keep showing up, and eventually we either get that one person to test, and that's always a win, or get asked to come back. So
that's amazing. And I just commend you and your team for having that commitment to the community and not backing down when, maybe there isn't always that immediate support or that immediate confidence in what you do. Just the fact that you believe in it is enough to, continue the work. So I think that's incredible. So thank you.
Sorry.
No, it is emotional. It's like you do important work. So.
Sarah, what should someone expect when they go in for an HIV or an STI test?
You should expect to get graded by a prevention specialist or myself. We'll be there to walk through the entire process. So from explaining how the test worked to just listening and being a judgment-free zone. We care about you and your story. We want to make sure that you have all the tools that you need to continue to meet your needs, whether it's getting connected to the HIV care, treatment, or getting items such as bleach kits, sharps containers, referrals to homeless support or other agencies, condoms or lube, and we're here for you. So just whatever you need in that moment.
We love
That's awesome.
it.
Yeah.
How often should people get tested, and what factors influence that?
Yeah, that really depends on the person and just kind of what types of sex they're having, how often we're having sex, how many partners we may be having sex with. So we suggest every 3 to 6 months, and then especially like doing it yearly. And then after, everyone should be tested no matter what, once in their life. So even if you're not sexually active, you should be tested once in your life.
And would you suggest after every new partner?
I would.
Okay,
Yep.
absolutely.
Perfect.
So what is one thing that you wish that everyone knew about sexual health or prevention?
I like that one.
Just be informed, be an advocate, spread the word, and get tested regularly, and encourage those that you know and love to do the same.
Yep.
And then come volunteer with us. We do a lot of different events throughout the year, so they're all fun. So come and just see what we do and what we're about. And then the last thing I would say, join us for PAB. If you're passionate about the work and you love the work, come be a voice for us.
And that is the Prevention Advisory Board, which is folks in the community giving us advice on how to best reach the folks that we're wanting to reach through prevention. Yeah. So, yeah, please join.
Sarah, before you ask my next question, I wanted to know, if somebody is exposed to an STI within, let's say, the last 24 hours, can they do something before telling themselves that they've contracted something?
Yeah. If you, let's say you had an exposure to HIV or had maybe a random incident happen over the weekend or something or last night, you can come and talk to our team and we can get you something called NPEP. So it's post-exposure prophylaxis. And that needs to be had within 72 hours of the exposure, but it's critical to get in as soon as you can. So.
Wonderful.
That's great to know, because I feel like not a lot of people know that.
Yeah. Absolutely.
We do have something called DoxyPep. It's only been tested and approved through Center for Diseases.
Oh, yeah.
So we do have DoxyPep now. There's some key factors to that, though, so it's a little bit more complex. So if you are interested in that and you are someone that was born a male, then you could come in and talk to your provider about DoxyPep.
Perfect.
Nice.
Thank you. Where can our listeners or our watchers go get tested or learn more about protecting their sexual health?
Yeah, come talk to us. So if you have questions, even if you don't want to get tested or you're not ready to get tested today, you can still come have the conversation with us. We can make it normalized as much as possible. We can help you with any stigma or any trauma that you may be having around testing. And then you can always go to our website, which is PHC, theproject.org. We have testing information there, and that's also an easy way to get signed up for free testing.
Wonderful.
Perfect.
Well, Sarah, before we let you go, we did want to ask you, how do you live out our eye care values?
Well, I feel like I personally share the same values, so it's very easy for me to live these out daily. But I would say the biggest one for me is access to care. I do whatever I can to not have to close down a schedule or to not be in the community at an event. So I do a lot just to keep those appointments open and have access to our community.
That's awesome.
Well, thank you so much for being here, Sarah. It's been great to have you on. And the work that you and your team do is so important. And so we're just grateful that you would come and even share a little bit more with our listeners about what it is that you do. So thank you so much for being here. For our listeners, I want to let you know that we are also available on YouTube, so you can watch us. And if you are a watcher, usually, just so you know, we are also available on Spotify, Apple Podcasts, and anywhere else that you would listen to podcasts. So we will see you all next time.
Thank you.